Placebo effect on muscular strength and endurance. Placebos are a treatment or supplement that is completely inert for what it is being treated. The effect the placebo creates does not arise from any physical properties of the placebo that is being consumed, but from the context of the treatment, from the individual's belief in the placebo. Placebos have also recently been used in the sport and fitness industry, especially related to supplements and resistance training. Many studies using placebos exist to test specific supplements and their effects on strength training. The effects of phosphatic acid supplementation have been tested in a study using a placebo group and a treatment group. The study showed that the placebo had the same effect in this double-blind study on peak power output, as there was no significant difference between the groups. Some studies on the actual effect that placebos have concluded different things. A review of many studies involving placebos concluded that placebos were powerful treatments that have a high degree of therapeutic effectiveness in treating specific responses in approximately 1/3 of all patients. A later meta-analysis study, including a placebo condition and a no treatment condition, found little evidence that placebos have any effects. Although there are studies and analyses on the effect that a placebo has, there is no clear answer as to whether or not they are valid. The present study will build upon these previous studies to specifically analyze the power of a placebo. The purpose of this study is to investigate the effect that a placebo has on a participant's performance in regard to muscular strength and endurance. The null hypothesis in this study is that the placebo will have no effect on the participant's 1RM bench press and squat and the amount of squat repetitions at 80% of 1RM and the amount of bench press repetitions at 80% of 1RM. The alternate hypothesis states that the placebo will have an effect on the participant's 1 repetition maximum bench press and squat and the amount of squat repetitions at 80% of the participant's 1RM during bench press and squat. A within subjects design was utilized to investigate the placebo effect on upper and lower body skeletal muscle strength and endurance in a group of college-aged men. 15 college-aged men who were apparently healthy volunteered to participate in this study. Each participant had been performing upper and lower body strength training for at least 3 days per week and had not consumed an ergogenic aid in the last 4 months. During the familiarization period, subjects signed informed consents and medical history forms. During each of the testing sessions, participants were administered a sugar tablet. To initiate the placebo effect, prior to the first session, participants were told they were consuming a powerful supplement that would increase their muscle strength and endurance by 10 to 15%. Following completion of Trial 1, the placebo effect was removed as the experimenter told participants that another independent study of the supplement found it had no influence on skeletal muscle. Participants then reported for the second testing session. In each testing session, a standardized warm-up of cycling at 60 watts for 5 minutes was completed. Each assessment of the 1RMs and 80% repetitions were conducted in the same way, with each 1RM being assessed within 3 to 5 working sets with 3-minute rest periods, and the muscle endurance was tested by participants completing as many repetitions of their 80% of 1RM as possible. After all subjects completed the testing, they were contacted and informed of the placebo. The data was analyzed using the Microsoft Excel add-in RealStats. Alpha levels were set at 0.05. Within group ANOVAs were used to see if there was a significant difference between the trials. Post-hoc tests of paired t-tests were then calculated. Our results show that there is a significant statistical difference between baseline and Trial 1 testing for the 1RM squat and bench press and the squat repetitions at 80%. There was also a significant difference between baseline and Trial 2 for 1RM squat and bench press, as well as the squat repetitions at 80%. There were no statistical differences seen in the 80% 1RM bench press repetitions between any of the trials. There were no significant difference between Trial 1 and Trial 2. No significant changes were found in the nutritional data. Our results show no increase in the bench press muscle endurance task. A meta-analysis by Rawdon that involved 37 placebo studies supports this finding. The meta-analysis suggests that endurance throughout the placebo trials did not show a significant increase. Aligning with our results in the 1RM bench press and squat, these findings also suggest a strong increase in strength throughout the placebo trials. Our results showed no significant difference between Trial 1 and Trial 2 results, meaning that participants' strength and endurance did not change once they were told that the supplement did not work. A similar study by Calasantas using 1RM for both bench press and leg press showed that after the placebo effect was taken away, the results significantly decreased. These results were different to our study, as a statistical difference was found after the placebo was taken away compared to our study, which showed no change after the placebo was taken away. A reason for the difference in these results could be due to the difference in participants. Our study used only athletes with resistance training, compared to Calasantas' study, which did not. Subjects with resistance training experience will already have experience with 1RMs and work to maintain or increase them. Untrained subjects, however, will have little understanding of their specific 1RMs and not be aware of their own capabilities. Future studies should analyze the placebo's effect in different situations, such as aerobic exercise and team sport. A future study could also compare the effect of the placebo in trained and untrained athletes. Females should also be incorporated into future placebo studies so that the results are not based on males alone. Limitations to this study include that the subject's perspective was not incorporated, so whether or not they believed in the placebo is unknown. Another limitation is that no control group was used to compare the data to. In conclusion, the placebo had an effect in 3 out of 4 of the conditions tested. 1RM bench press, 1RM squats, and 80% squat repetitions showed significant increases between baseline and the trials. Revealing to the participants they were consuming a placebo did not show a significant difference in the data. Strength and conditioning coaches could use this information with their clients by telling them a certain supplement has a powerful effect in order to get the achieved results of increased strength.